Peters here from Omaha Spine and Sport. Today we're going to talk about neural tension and what that means for a variety of conditions, whether it's sciatica, carpal tunnel syndrome. Basically, anytime we have numbness, tingling, or pain in the extremity, we work patients through neural tension tests like the straight leg raise, Slump's test, cross straight leg raiser. And what that is we're looking to test the integrity of the nervous system or the nerves. We actually use one of these TheraBands to kind of demonstrate to patients just what we're kind of testing when we're pulling and kind of moving them around in different directions. So if we want to think about the nervous system, we have the brain, spinal cord, and then the nerves go out to the periphery. So anytime we have numbness, tingling, pain, we have to test both the nervous system to see if we have positive neural tension signs, as well as move the spine. And that's going to kind of get into the two different types of neural tension, or the two different causes, We have container specific and neural specific. So the first one, container specific, that's like your stenoses, your disc bulges, anything where local tissue is causing compromise to the nervous system. So if you think about your neck, if you have a disc bulge in your neck, the nerves run out. That inflammatory cascade may be causing irritation in the nervous system, and it kind of shows up in a dermatomal pattern or a very specific pattern in the periphery. The neural specific is usually it's a little less specific. It's not dermatomal. It will be more like along a certain path. So that is just a problem with the resiliency or the robustness of the nervous system, meaning it can't tolerate the forces. So when you think about a neural tension test, you think about this. This is your nerve. It runs from your brain down your neck out to your arm. So how we can do that if we're testing the median nerve or the nerves or part of the nerves in the upper extremity is we can put it under tension with our wrist. That means we're pulling it towards the hand. So we're tensioning it this way. Right, you can even do this if you take your arm back like this, you can feel a little bit of nerve tension. You might feel some, like a tight hamstring in through the elbow, or you might feel a little bit of numbness and tingling. So you can do that, okay, that's where you feel it. And then if you take your head the other way, you're actually pulling it from both ends now. So this is called a tensioner. And the important thing, and why a lot of times their sciatica doesn't get better, their carpal tunnel syndrome doesn't get better, is because we're treating the wrong thing. Remember, the two different causes are container specific or neural specific. So if it's a container specific problem, we need to solve that problem, not just the neural specific. So the neural specific is, we're going to kind of talk about neurodynamic techniques, the flossing, some of the David Butler stuff. When it comes to container specific, that's the adjusting, the soft tissue, the repetitive movements, the McKenzie method. All of those are different types of container specific treatments. We're going to try to move you, let's say it's a cervical spine disc bulge, we want to try to find a mechanical movement, a direction of preference that we can move you through, taking care of the spinal issue, and the periphery will just come along for the ride. If we can take the insult or the irritation off the nervous system around that is getting irritated within that container, then the periphery will clear up, and we actually don't have to do a lot of these nerve flossings. Now, if we continue, we screen out the spine and we realize it's not a container specific issue, then we can get the nerve stuff out. We can do the nerve flossing and kind of make this a little bit more robust, so the nerve can tolerate the movement. Because a lot of times, if you don't move something for a long time, the nervous system can no longer tolerate it. So we need to kind of work our way up to that. Sometimes we need to work at a joint next to it and kind of do more elbow stuff, even if it's a hand issue, because appreciate if we bring our elbow like this, we're actually tensioning the nerve too. So slacking the nerve, tensioning the nerve. Same with the wrist. Tensioning the nerve, slacking, tensioning, slacking. So a lot of times I have patients kind of doing these goofy little movements, and all it is doing is it's just pulling on that nervous system in a different way. The best way to kind of create more nervous system robustness is to move. My problem is that patients aren't moving enough. They aren't moving in a variety of directions. We kind of go to work, we do the same thing all day long, and we never really move. So those are some of the things and that's a lot of times why your sciatica and your carpal tunnel syndromes aren't getting better, is we haven't determined which one is the two kind of driving this. They're not mutually exclusive, but if we have a container specific and a neural specific, we have to address the container issue first. Otherwise, if we have a container specific issue, think that disc bulge, and we just kind of tug on this doing a nerve floss, it's just going to tick that nerve off even more. We might get more numbness, we might get more pain in the periphery. So those are something to think about. It's very, very important to get assessed for nerve tension. If you think about it, in the low back, kind of pop over here, it's no different. So if I put this around my foot, right, we can do a slumps test, right? So we first part of slumps is we bring the foot up like this. We're tensioning the nerve and pulling it towards the foot. And then we're bending our head forward, and now we're pulling it from both sides. So we're looking to see if that can recreate any of the patient's symptoms to see if neural tension is even an issue. And if it is, then we need to try to screen out the spine first and see if it's a container specific or if it's something that we can do with some more flossing. Okay, so if you have any questions on neural tension, it's just tightness within the nervous system, and it can kind of tell us one of two things, whether it's the container or if it's the neural issue. So give me a call if you have any questions. I'd love to be able to help you. We treat a lot of radiating pain, a lot of numbness and tingling in the periphery, so let us know if we can help. Omaha Spine and Sport.